Okay, so I'm in the office and I'm looking at this thing and I'm hoping that it's not that fat part that's gonna go inside my damn pee hole. Um, Honestly, I just who likes pain? Okay, who likes pain? But it's more so it's just uncomfortable. But I'm here and I'm waiting for the doctor to come into the room. So, yeah. This is the Black Diamond Misfit. I'm here with the doctor, and he's going to tell me what the procedure is about. So,
Yeah, so the reason that we're doing this, once again, remember, is because you had the blood in the urine, right? Nothing that you saw, but you had some blood in the urine under the microscope when we looked at it.
okay.
So what this procedure does, it's a very small camera. It's like a very small catheter. Goes in the channel that you pee out of, and it lets me look inside the bladder. And you actually will get to see everything that I'm seeing if you have any interest at the
Okay.
same time.
Okay.
You had an ultrasound today.
Yes.
Okay, what the ultrasound showed is you actually have a little kidney stone in the kidney.
Oh.
That actually may be, is probably the reason why you're having the blood in the urine. But we do typically do this procedure just to kind of make sure.
Okay, now seeing that you said that they found a kidney stone in the ultrasound,
Correct.
so does it has to come out?
Well, not necessarily. So if you want, let's kind of do the procedure first, and then we'll kind
Okay.
of talk about what the next steps are after that. That's
Okay.
just kind of the easiest thing. This just is the consent form. It says that we're just looking inside your bladder with a camera today.
Okay.
You know, the risks of the procedure, may cause a little bit of discomfort when you pee after. You may see some blood in the urine. And there's a small chance of an infection.
Okay.
We checked your urine today. There's no signs of any infection now.
Okay.
All right.
Okay.
So we're just gonna have you sign. All right. So the bladder looks totally fine. Absolutely, completely normal.
Okay.
It's likely that the microscopic blood was from the kidney stone.
Kidney stone.
So there seems to be a relatively small kidney stone in the kidney.
Okay.
When they sit in the kidney, they don't cause any problems, right? You don't have any pain on your side, nothing like that.
Well, no, I do have it from time to time, but it's not an ongoing pain.
Right.
I get it from time to time. It feels more like a muscle spasm.
Sure, that's what it might be. You know, when stones are not blocking the kidney, when they're just hanging out there, they don't usually cause any problems. It's when they move and they get stuck in the tube that drains the kidney. That's when people get pain from kidney stones.
Okay.
There's no way to predict if that will happen.
Okay.
So there's kind of one or two things we can do. One is we can just keep an eye on it. And the way that we do that is we basically check like once a year with an ultrasound to make sure it's not getting any bigger.
Okay.
The other option is to do a surgery to remove it. Honestly, my thought process is, given how small it is and the fact that you're not really having any symptoms, I think it's completely reasonable to keep an eye on it.
Yep.
And just do another ultrasound in about a year.
I'll stick with that.
Okay. And that's like, if I thought you needed anything different, I would tell you. But I think that's completely safe and completely reasonable.
Okay.
But I think that is the likely cause of the blood in the urine.
Okay,
so
so it's a kidney stone.
That is correct.
That hasn't moved. It's just sitting.
Correct, just sitting in the kidney.
It's just sitting in the
Kind of
kidney.
just hanging out.
Hanging out, okay.
Yeah. The problem is that, I don't have a crystal ball.
Right.
So I can't predict whether or not it will move or kind of cause you pain in the future. There's no way for me to predict that.
Okay.
So, given the size of it, I do think it's very reasonable to just keep an eye on it.
What is the size of it? What did you see the size of the kidney?
4 millimeters, which is it's literally less than half a centimeter. So it's like that big.
Okay.
I don't know if you can see that at all. It's quite tiny.
Okay.
So it's very, very small. So if it was much bigger, I would say, maybe we should consider surgery.
Right.
Because of the size of it, I think it's very reasonable to just keep an eye on it for now.
Now, how did that kidney stone, did I do anything?
You didn't do anything wrong. These sometimes just form.
Okay.
So there's a couple things that you can do to help prevent them moving forward. Hands down, water intake is the most important.
Water intake. Okay.
Do you drink a lot of water?
I do drink a lot of water. I do.
How much do you typically drink?
At least I'm about 4 or 5 a day.
Like what, glasses, bottles?
Bottles.
That's actually pretty good.
Yeah.
That's usually what we recommend. The second big thing is limiting salt in the diet.
Oh, okay.
I'm not sure if you eat a lot of salt.
No, I really don't, but when I do, it's not, well, to me it's not a lot, but
Sure.
I can eliminate salt.
Sure. So what I'll do is I'll give you a nice little handout that kind of goes over specific things in the diet that
Okay.
you can do to kind of help prevent stones moving forward. Does
Okay.
anyone in your family have a history of kidney stones, as far as you know?
I don't know.
Not that you're aware. Okay.
Not that I'm aware of.
All right. So we'll kind of give you that. We'll plan to do the kidney ultrasound in 1 year.
Okay.
Okay. And then I'll see you back in a year, kind of check in, see how things are going.
Okay.
And then obviously if there's any concerns before then, you just give me a call.
Okay.
Does that sound pretty reasonable?
Sounds good to me.